So look at this concept in respiration. All right. So this concept is known as what? The FEV1 or FEV1 over FVC. Okay. So we are looking at the application. So first of all, look at the FEV1, look at the second one, then look at the interpretations. All right, that's looking at the meaning of this concept in what? Respiration, in the respiratory system. So by saying that the FEV1 and the FEV1 over FVC, they're actually important metrics in pulmonary function testing. Okay. So for the FEV1 in that's basically in 1 second. That's the FEV fully means what? Forced expiratory volume in 1 second. It actually measures the amount of air that can be exhaled in the first second of a forced exhalation. But let me say here like this. Do you understand? Forced exhalation. It will measure it. It represents the what? Rate of airflow from the lungs. Okay. So the normal values should be between 80 to 120% of the predicted value. Then looking at the ratio now, you are now saying this forced expiratory volume in 1 second divide by forced vital capacity. So the ratio of this is actually what? The total amount of air exhaled. Okay, so it represents the proportion of what? Air that is exhaled in the first second. Okay, that's proportional. The normal value should be between what? 70 to 80 or even higher. Okay, so what is the interpretation of result? If you are finding the forced exhalation volume in 1 second to be less than 80, that means what? The airflow is limited. If it is more than 80%, the airflow is normal. Okay, so if you are finding this ratio to be low, that means you are dealing with things like obstructive disease. Okay, if it is 70 to 79, it's mild. If it is above 80, that means there's normal or restrictive disease. Okay, well, all right. So I think basically that's it for this concept. Okay, so this metrics, or that's the forced expiratory volume in 1 second and its ratio, is used in diagnosing and monitoring how patients recover from disease conditions like what? Chronic obstructive pulmonary disease, asthma, pulmonary fibrosis, cystic fibrosis, and all of that. Okay, so that's it for this lecture.